Okay, so good afternoon. Now let's talk about um, viral diseases. So let's start with the rinderpest. So your rinderpest is also called your cattle plague. Actually, this is the very first animal disease that is eradicated around the world. This is a disease of cloven hoofed animals, which is also considered as the most lethal plague in cattle, characterized by fever, necrotic stomatitis, gastroenteritis, lymphoidectosis, and high mortality. Now, we have historical features for this disease. Now, this is the first modern veterinary school in Lyon, France, in 1762. It was actually founded because of the outbreaks of this disease. No, so even in the Philippines, the first veterinary school, no, in UP Diliman, was even founded due to the occurrence of this disease. And the World Organization for Animal Health, or IE in France, then again, was also first established in 1920. It's established in 1920 because of this disease. And in 1952, your Food and Agriculture Organization and your OIE had a cooperation agreement to to really eradicate the disease. And the last reported outbreak then was in Kenya, 2001, and it was later on declared that there has been a global eradication for some time. Wala the outbreak niga was for 10 consecutive years. It was declared thereon that the disease is globally eradicated already. And okay, so I was wrong. This is the second viral disease eradicated worldwide. So I think the very first was the measles, then followed. So this is caused by a morbillivirus of the paramyxovirus. So basically, this is a cousin of your in distemper, no? So replication is in epithelial and lymphoid tissues, and then later on the GIT and respiratory tracts. So it is quite a peculiarity that many of the diseases coming or yeah, caused by your morbilliviruses of the paramyxoviridae starts at epithelial tissues and tissues, no? So all species of order Artiodactyla are susceptible to this. When you say order Artiodactyla, these are our hoofed animals. When you say animals, ito na ay mga sike, no? Particularly the even-hoofed animals or the even-hoofed animals. So most of our domestic animal species in the food animal practice belongs to this group. We have our swine, we have our caprine, bovine, no? Balines, no? So all of which belongs to the FMD. And what is very interesting is that your cattle, buffalo, and yak, large ruminants, are most susceptible to this disease as compared to the other artiodactyls. Now, there is actually a cross immunity between strains, or there is even a cross immunity between diseases of the morbili viruses. No, so actually during the eradication of rinderpest, it has affected the epidemiology of many other morbilliviruses during the time. So usual transmission would be coming from the nasal and ocular secretion of the infected animals. And later on, there could be a probability for any direct or indirect contact. So from that, that could just good ang outbreak. For example, there are nasal and ocular secretion on the wheels of the truck, and then the truck went one from another. The transmission could go on then. So virus dies 12 hours after environmental exposure. So the thing with this virus is that it really dies outside the body of the host. And infection between maternal immunity and vaccinal immunity could actually counter each other. So that is quite the problem during the time because the maternal immunity, so the maternal immunity could counter the vaccinal immunity, and there is a lot of time before the maternal immunity fades away. So medyo taod pa ahead ng vaccinated animal, unlike other um, vaccines in ruminants. Now, like for example, your hemorrhagic septicemia, you usually vaccinate for that for around 3 to 4 months olds. But if you're rinderpest, medyo dugay-dugay pa na siya. But later on, we'll have the prevention and control. So that for the epidemics, the disease could actually cause 90% mortality in an affected farm, and the morbidity could reach up to 100%. Although it could be lower in endemic area because of course in endemic area the antibody is already circulating through the herd, no? But then again the morbidity could rise up to 100% and match that up with a 90% mortality. There is indeed a very strong effect on economic implications when there is an outbreak for your reindeer pest. So for the clinical findings for this disease, there is direct and close direct contacts with susceptible 6 animals, patient period of around 14 days, and you have your DDD as your clinical findings, no? Your animal will develop depression, fever, anorexia, oculonasal discharges, very common lesions or clinical manifestations in your animal is having a feverish and a feverish na condition, na? So necrotic lesions in gums, buccal mucosa, tongue, and palates, and thereon, yeah, the disease would really affect the total well-being of your animal. It would start to affect the eating, no? Because of course there will be necrotic lesions. Those are not just ulcerations but necrosis. So mucopurulent discharges, dry and crackled muscle. So there would be a very apparent manifestation in the face of your animal, starting from the nasal cavity and to the oral cavity. Also, because there is an effect on the epithelial cells, which would most likely affect the epithelium surrounding the inner part of the intestine, there could be a very high probability of diarrhea, and later on, your animal may succumb to death. So for the lesions, GIT and respiratory tract lesions, no, imagine lang gani class that the virus infects the epithelial cells. So of course, most of our, especially the wet epithelial cells, so imagine the GIT and the respiratory tract then. So necrosis, erosion, congestion, hemorrhage will be very apparent. Well, anyways, if there is a necrosis of the epithelium, erosion, congestion, hemorrhage almost always comes then. So zebra striping in the rectum. So later on we'll have a picture of that. Necrotic fossa and Peyer's patches. Because then again, your virus can infect the lymphoid tissues, and of course your Peyer's patches is but an accumulation of lymphoid cells. So lymph node enlargement. So there will be an lymphadenopathy. So intracytoplasmic and intranuclear inclusion bodies. These will become the remnants of the virus as they infect the cells, and lymphoid and epithelial necrosis. You know, because of course, then again, the virus infects the lymphoid and the cells. So our diagnosis for urine pest is clinical diagnosis, viral identification and isolation, inclusion, test, immune capture ELISA. So basically, when you say immune capture ELISA, you capture the antibody responsible for the disease, may it be IgG or IgM. You also have your RT-PCR. I think this is duha mo ni kabuk ang definition sa RT-PCR. You have your real-time and your reverse transcriptase PCR. For your I think this is reverse transcriptase PCR and your simple lateral flow test. So your PCR there and your ELISA are our gold standard for this. So you have your ELISA for your serology and later on followed by RT-PCR for any seropositive animals. So oral lesions variable. Start a small gray foci that may coalesce in gray necrotic epithelium, then sloughs off and leaves a red erosion. So when you have a necrosis in the oral cavity, the most or the usual na appearance would be a grayish na growth. Mura ko nag-ugam plus kamo na may ko ay lesion sa gums, medyo na siya mag-grayish. That means that the cells are actually dead, and when it sloughs off, it will expose a red alive na mga cells underneath, no? So mouth on the gums, lips, hard and soft palate, cheeks and base of the tongue, early lesions are gray, necrotic, and pinhead-sized area. So basically, the ulcerations here for urine pest are diffused all over the oral cavity, and the usual pattern is that they start small, and then coalesce, so they would appear very large later on the disease process. So we also have here ulceration of the tongue, gingiva, and palate. No? So you have your udder here, which is also infected, and the teeth. No? So there really would be cracking of the muscle. You can notice these are cracks of the muscle. The tongue has also small pinhead size ulcerations, although not so clear with the picture. And there is other involvement in the disease picture. No? So here there is a very projectile area and very wet area, almost wala na siya gikaon. Basically, imagine inyong animal, wala na siya nagkakaon because of the anorexia, total feeding, but still they are experiencing diarrhea. The animal may not even be drinking at this time, but still they have diarrhea. The dehydration is superb in this stage. So control, lifelong active immunity is very good. The very good thing with this disease is that there is a lifelong active immunity. Once you vaccinate your animal, there will be a lifelong immunity. No? So pwede din like a booster. No? So and the problem lang, however, is that the maternal immunity lasts for around 6 to 10 months. No? So because it starts from 6 to 10 months, it ends only at until 6 to 10 months. Imong vaccination taod-taod pa. Now, of course, yung maternal immunity is not lifelong. It will be waning or it will fade at some point. Now, the usual disease outbreak or the usual infection starts between the maternal and vaccination immunity. So the time that the maternal immunity is starting to fade, but yet there is no vaccination. That is the usual time when the animal is gets infected with the disease. Now, as for the endemic areas, immunization of animals or wrong na siya, greater than 1 year of age, no? So why does it need to be greater than 1 year of age? Because then again, the maternal immunity is could reach up to 10 months, and of course with that medyo kuan siya, medyo dugay siya, and so they would opt na medyo mas layo-layo na tiguang na animal before siya i-immunize. The problem is that time period, let us say, what if dito siya sa 7 months nag-fade ang maternal immunity? What would happen then for the rest, for 8 to 12 months? No, so medyo wala siya immunity at that time, and the disease could infect the animal. They also practice ring vaccination during the time, especially for landlocked territories. So when you say ring vaccination class, imagine Bukidnon. Your Bukidnon is a landlocked province, correct? Now let us say there is a vaccine. Now, when you say ring vaccination, they would vaccinate the animals on the periphery of the territory. Let us say, si Bukidnon, iya mga periphery ng mga territories would be barangays in Manala Fortich, barangays in Itaw-Taw, no? So those areas that are in direct contact with the other provinces, like in Manolo, you have your Alae in contact with Cagayan. They could vaccinate all the animals in Alae. And then that will happen to many other barangays that are in contact with the boundaries of other provinces. So why is it done that way? So para ang mga animals on those barangays, if for example na ay mapalit sa hangin ang virus, of course there's a possibility of your virus riding the environment, no? Depende sa virus. So if the virus would, or even if pasig na mga animals, neighboring farms or so, so if the virus would go onto those farms, the animals there won't have the disease. Now, if the animals there would be able to resist the disease, there will be no increase in the viral load in the environment or in the province. And so your Bukidnon could be spared from the outbreak. And of course, slaughtering or destruction of those which are identified. And epidemics, quarantine, of course, slaughter of infected and exposed animals. Even the exposed animals are slaughtered. That is a very same concept class with your ASF right now. So those animals that belongs to a barangay or inside the radius which has the infected animal or confirmed animal, all of those will be slaughtered. expected that they are somehow exposed to virus, and control of animal movement. Now, class, why am I discussing to your reindeer pest despite of this disease being eradicated already around the world? It's because scientists nowadays are actually fearing the reoccurrence of urinary pest because of the number one fear was the melting of the ice caps, because some studies have shown that there are virus species, or is that called a species? No. There are viruses that survives ultra freezing. Still, they could be isolated even after ultra freezing. When you say ultra freezing, that is in laboratory settings, that's negative 80 degrees, or even freezing alone. No, so because then again of the climate change, there is a probability of the reoccurrence of viruses or diseases that were that are known to be long gone now. So one of those diseases that are being feared is urine pest. Now let's proceed with your pastidespatids. So this is very, very similar with urine pest, and this is a very important emerging disease for the Philippines. So an acute and subacute viral disease of small ruminants characterized by fever, necrotic stomatitis, gastroenteritis, pneumonia, and death. So if you could notice, your pastidespatids or your PPR is actually very the same with your rinderpest, such that the only thing is that it infects the smaller ruminants. So still they belong on the same genus virus, your morbillivirus and your paramyxoviridea. So replication in epithelial cells and lymphoid tissues, same with your rinderpest and your GI and respiratory tract. So dali na siya no? So close contact between susceptible and sick animals, that's a very, very important route of the disease transmission. Equal susceptibility for goats and sheep. So this really attacks your small ruminants, and more severe, however, with your goats. So even if they have that equal susceptibility, usually the disease would present to be more severe with the goats as compared to the sheep. So large ruminants and swine are usually subclinical. They can be affected. They are still susceptible, but they present themselves as subclinical. When you say subclinical, then again, if the animal may be infected, but they won't present stage one. So no zoonotic risk. Good thing is that your PPR does not infect the humans. All parts of Africa spreading through Asia is infected with your PPR. Now the problem is there is now a rapid spread of this disease after your rinderpest eradication and high epidemic mortality. So why is that, and why is it hitching with your rinderpest? Remember that your morbillivirus has a cross immunity against each other. That is a very upon siya, characteristic with the morbilliviruses na they're able to create cross immunity with each other, no? Remember, kanang kaya na distemper nyo, pili nyo tagaan o tasota vaccine na ba? So anyways, point being is, as they were eradicating your rinderpest during the time, they were actively vaccinating proven animals, the archaeodactyls with rinderpest during the time. They were able to suppress PPR, no, unconsciously. So incidentally, your PPR is also being suppressed during the eradication of your rinderpest. But when they were able to indeed eradicate your rinderpest, now your pestidespatids doesn't have a break anymore. Wala na iyang break, no holds barred na siya. So what happened is that there is now a rising epidemics of this disease. Kanang hitch naman siya sa control ni rinderpest, na karang kinawala naman si rinderpest. So wala na para sa iya, wala na siya break. Padayon na siya. So for your clinical findings and lesions, still very the same with your interpast. However, the incubation period is way shorter at just around a week. Gawas na siya. Your interpast is around 2 weeks. So 5 to 10 days, there will be an apparent hypothermia and death, and non-specific signs like fever for around 41.3 to 40 degrees Celsius, dry muscle like your interpast, restlessness, and congested mucous membrane. There will also be serious oculonasal discharge in the earlier parts of the disease process and later on mucopurulent with putrid odor. Why is there a putrid odor? That is because there is an active necrosis of the disease of the organs, of the epithelium, no, involved. So you, for your gastrointestinal tract, you have your mouth and abomasum being largely affected with the disease. And of course, your large intestine, especially on the ileocecal valve, cecocolic junction, and the rectum. So erosions will also be very apparent. So shallow with red, raw-based, pink, uh, raw-based erosion. So mabaw lang siya, but it's kind of pinkish because of course exposed ang mga capillaries, and later on it will be pinkish white, so medyo ma-block po to ang capillaries na na-expose, no? So bound with healthy epithelium and demarcated margins. So one thing with this disease is that yes, you will see the shallow and red raw base. You will later see, you will also observe on the periphery that there is healthy epithelium and the margins are very well pronounced. So abomasum oozes with blood, so it looks like the disease is creating somewhat in abomasitis or a hemochromatosis in your small ruminants, but it's just that there is an involvement of the epithelium of the abomasum. And the Peyer's patches usually sloughs off because then again, there is lymphoid involvement of the disease. Now, with the GIT involvement, you can also find necrotic stomatitis. So when you see necrotic stomatitis, the gum line of incisors, the dental pad, the palate, the cheeks, and papilla, and the tongue would have some sort of stomatitis, or as nga, would have a similar appearance with your urine there, but it's kind of grayish, and it could somehow slough off, no? So conjunctivitis, crusting at medial canthus. So if there the crusting at medial canthus would look like there is kanang muta-muta, no? So matting of eyelids and profuse catarrhal exudates. Because of course with your conjunctivitis in this point of the lesion, there is most likely an involvement of, I know there is most likely mucopurulent discharges also. And so that mucopurulent discharges and serous discharges itself would be quite sticky for the, especially for the eyelashes, and naglisod ka siya ibuka-buka sa animal. Diarrhea, profuse dehydration and emaciation, and the respiratory tract will have petechiation, patches of bronchopneumonia, late stage coughing, late stage, then coughing, and the necrotic fossa in the floor of nasal cavity. So not if you'd notice the diseases being discussed has necrotic foci, on the epithelial tissues, may it be on the nasal area or in the oral area or on the GIT itself. So with the purulent eye and nose discharges, you could really see here that the discharges from the nose and eyes in advanced PPR infection, taas siya, medyo tikit-tikit on. Hindi siya makamata o ayo. It cannot open its eyelids well because of the stickiness. And the hair below the eyes is wet and there is matting. So nganong wet ang hair below the eyes? Because of course, the secretions on the medial canthus would slowly down, no? And it will stain the hair below the eyes, and there will be a partial blockage of the nostrils by dried up purulent discharges like this one. So there is partial blockage, and then the eyes cannot open very well. So conjunctivitis, inflamed reddened eye membranes. So reddening of the conjunctiva on the reddening of the conjunctiva on the early stages. On the early stages, more pa siya og kanang bloodshot lang siya na eye. But later on, it will be very inflamed. It won't be able to open. So note the purulent eye discharges. The purulence, the mucopurulent discharge would be the responsible, would be the reason why your animal won't be able to open its eye well. Oral lesions, swollen, eroded lips, no? And the dermatos, and show areas of erosion on the lips. It would look like an orf or a contagious ecthyma, but there is a concurrent ocular involvement, which is your conjunctivitis. So early mouth lesions, pale gray areas of dead cells on the gums, diba? Urine derpes, you remember the necrotic foci of urine derpes of gray areas. Same cell, same also here. the gray areas or the gray coloration is actually due to the dead gums, no? So later mouth lesions, you have your membrane lining of the mouth is completely obscured by a thick cheesy material. So the cheesy material is composed of the dead cells and the mucopurulent discharges, and there will also be a shallow erosion underneath the dead surface cells. So the the dead cells basically are sloughed off cells from the gum itself. No? So early pneumonia, note the small red solid areas of lung tissue. So in the early pneumonia, on the early stages of your pneumonia, the the lung tissue would be quite hemorrhagic. So advanced pneumonia, note the extensive dark red purple areas firm to the touch in the anterior and cardiac lobes of the lungs. So this is basically hepatization of the lungs, no, especially on the anterior and cardiac areas of the lungs. And although uncommon, it is caused by secondary bacterial infection, most commonly by Manhinga hemolytica. These lesions are typical of pneumonic pasteurellosis. So there is a concurrent infection of your virus and your bacteria, especially now that the immunity of your animal is, of course, decreasing. So your virus has led to the decrease of immunity and co-infection with your Manhinga hemolytica. And the lesions that you would find with your Manhinga hemolytica will also be found with this disease. So this is how your zebra striping looks like in the large intestine. So this is also true with your rinderpest. So note the lines of hemorrhage along the tips of the folds of lining of the cecum and colon. So here, no, there are lines of hemorrhages. So individual hemorrhages join up and after death turn black. So if your animal has died of urine derpes and you have necropsy death for about some hours, or not urine derpes, your PPR rather, and it has died at some point, and then later on you will see on this in the cecum, in the large intestine or anywhere in the large intestine, the zebra striping, and it would turn black. No? Pero kung patay mo, buhay pa mo animal, you sacrifice that one and killed you necropsy right away, you would still see this reddening because hemorrhage. Or if your animal has died fresh pa kayo. So this one. So marginalized stripes glands. No? So the diagnosis, clinical diagnosis, viral identification and isolation, agar gel immunodiffusion test cross-reacts with urine test. So this is quite a problem during the time because your agar gel will cross-react with your urine test. So antigen capture ELISA, so you have your IgM here and then RT-PCR following your ELISA. Usually your ELISA and your RT-PCR comes together. Also have your competitive ELISA and then your virus neutralization or your VN test. More than or equal to four-fold titer increase of paired sera would somehow suggest for the occurrence of the disease. No specimens of interest would be if you are to have an antigen or nucleic acid detection like your RT-PCR and your virus neutralization, lymph node, tonsils, spleen, lung would very wonderful for that. Because of course the disease would, the virus would go onto the epithelial tissues and the lymphoid tissues. And of course, if you want antibody detection serum for your, especially, for your serum. So eradication during epidemics, vaccination, attenuated PPR vaccine prepared in vero culture. So that's basically from a virus isolation and then more than 1 year of protection. No? So let's proceed with your foot and mouth disease. This is another disease that has been eradicated in the Philippines already. So your foot and mouth disease is also called your after fever. It is a highly communicable disease of cloven hoof animals characterized by fever and vesicles in the muzzle, teeth, and feet of affected animals. So this basically has somewhat the same appearance with your reindeer pest in a sense or in a way that it is able to create lesions on the epithelium. However, the very difference is that this starts as vesicular growth, no, as compared to your rinderpest that right away creates necrotic foci. So for example, if you are to look at the mouth of an animal, let's say a goat, kaya ang goat pa may naapay marbilin, no, kay wala na may rinderpest. Let's say a goat would most likely have dead skin cells which are gray in color on their mouth if they're infected. The the mouth has ulceration, but it's colored a gray, and if you remove the gray area, there would be a reddish congestion underneath on the, no? But for your FMD, it would somehow start in the earlier stages. It would start as a vesicle. So it's like there are boils in the feet and in the mouth of your animal. So a historical feature for this disease, 2006, we started the FMD eradication campaign. And in 2011, we indeed were able to eradicate the disease from the country as declared by your OIE. And in 2015 class, 2015 or 2016, I think that's 5 years thereafter. Because 2011, we were declared to be FMD free with vaccination. And then I think 5 years after that, that was 2016, we were declared to be FMD free without vaccination because we no longer were vaccinating for the disease since 2011. So Philippines declared as FMD free without vaccination then. So transmission and epidemiology, all species of order Artiodactyla are susceptible. So same susceptibility with your rinderpest. So inhalation or ingestion from infected source to susceptible animals, same transmission route with your rinderpest. Direct contact with infected animals, same with your rinderpest. Contaminated animal products. The difference with your morbilliviruses is that your FMD is a very hardy virus. It could very well survive in the environment without the animal hosts. So it could even go airborne. No? I have read of an article before saying that they could travel for like 200 kilometers or miles within the air, so long as they are inside droplets. So mechanical transmission of virus on people, vehicles, and etc. and shed on the milk. So your FMD could be very well shed in milk. So the etiology is your F2 virus of the Picornaviridae. These are very small viruses. So serotypes A, O, and C, and these are your serotypes that were present in the Philippines then. So class, there are lots of typing. Now you have your serovars, serotype, genotype, pathotypes. Well, it depends on the prefix. So here, when you have serotypes, these are basically group based on the antibody response of your animal. So the 1% in the Philippines that time was A, O, and C, no? So Asia 1, SAT 1, 2, 3, present only in Africa, okay? So viability, we have here the viability of the viruses depending on their kung asa sila makita. So you have 14 days for the dry fecal matter, 39 days in the urine. So approximately 1 month or 28 days in the soil surface during fall and 3 days in soil surface during summer. So there is really less disease outbreaks during summer. So as compared to the rainy season and more approximately 24 hours in humans. So this is why class, when you are a veterinarian later on that is handling disease outbreaks, especially kung naka sa LGU, NDA, BCC, and when you are to visit a farm that is where there is an outbreak, no? Example, ASF karon for our outbreak, no? So, if you are to visit a barangay para mag-clean up sa ilang baboy or euthanasia mo baboy, mag-depilation mo, dili ka pwede mo sulod sa pigas barangay, especially sa barangay nga lahi with their farm within for some time. I'm not so sure with their protocol. I think 1 week ata. Not so sure. Basta kay nana. Because you need to really get rid of the viruses. Your PVMA, for example, during the outbreak of ASF, there are swine companies that gibawalan nila ilang vets, mga pill of PVMA, because they are fearing that the veterinarians from other areas of the country would be harboring the viruses, and if mag-in contact mo, handshake mo dito, barkada mo sa high school, sa college, especially uban mo, so you could be transferring the virus and then mobalik ka sa mong trabaho, then you could be bringing the virus into your phone. So, in order to become a veterinarian later on, remember that whenever you are handling disease outbreaks, never ever go to other farms, no, because you could be harboring the disease itself. So you could have iatrogenic transmission of the disease. So there is environmental stability with your FMD, but at pH 6 to 9, no, medyo taas-taas na siya pH. And even at more than 56 degrees Celsius, they could still very well thrive, no? So resistant to lipid solvents, your ether and chloroform, because I think there is a lipid capsule for your FMD. So viruses with lipid capsules will only die with disinfectants which can attack the lipid. Of course, your ethers, your chloroforms, and ionic disinfectants, your sodium hydroxide, sodium bicarbonates, and your acetic acids. So in 2017, we have here a list of OIE member countries, official FMD status map, but it's not yet updated. So, well, di wala kay map for 2021 na list, no? So, member countries and zones recognized as free of FMD without vaccination. If you could notice, no, Philippines is FMD free without vaccination. So, naay status of FMD, napa sila din na sa Northern Asia. And kaning white countries and zones without an OIE official status, China here, Korea during the time, here Africa, no? So here member countries and zones recognized as free of FMD with vaccination. Included there is Brazil. I heard of an issue that goes like this. When the Philippines were about to import cattle, they were thinking first of Brazil because they wanted to import Girolando that time, or your Girolando, no, or yeah, your Giro. I'm not so sure how to. So anyways, but they were not able to import from Brazil. Sila ka-import sa Brazil because Brazil during the time was FMD free, yes, but with vaccination. And the Philippines were already able to get the without a vaccination status. And so, yeah, they needed to look for some other countries to source out. So the pathogenesis, direct and indirect contact, mechanical vectors, and the air could a very good source for the virus. And there is another route in the Philippines, labi na yung mga Pinoy. Kanang labi na akong pigiri, ilabay ang baboy sa suba, and all the farms downstream, appeal na din sila. And it's very rascal, it's very insensitive, but that really happens in our settings. So now let's imagine FMD mo ang gihandle, tapos farm upstream, na naglabay og baboy, downstream tanan artiodactyls appeal damay, pati baka, baboy. So sad. Igabi Pinoy. You remember itong nagsugod ang ESF, katong may mga baboy sa Quezon nga, sa pa ng lutaw. Pinoy. So incubation period, 3 to 8 days for the small ruminants and 2 to 14 days for the large ruminants. So if you notice class, no, mas dali ang incubation period sa small compared to large. Your Inderpest approximately 2 weeks, your Pestilence petites approximately 1 week. Now your FMDs spells the same incubation period. Now with the pathogenesis, your disease, the usual the start of the disease starts with the oropharynx, which is your initial site of replication. And now from the oropharynx, it will proceed with the blood or to the lymphatics. Pili lang siya. Masunod siya either the blood or to the lymph. Now, if it is now progressing towards the totality of the body, the epithelium of the mouth, muzzle, and feet and teeth will be included. Now, depende na siya class if there is mechanical trauma. Kung wala mechanical trauma, there won't be a development of vesicles. But if there is mechanical trauma, there will be a development of vesicles. Now, where are those parts of the body nga na ay trauma? When you say trauma here, class, we only need abrasions. Now, when you say abrasion, siya na-scratch lang ang epithelium and then nag-form the vesicles. So where would you find that one? On the mouth, no? Kung during eating. On the muzzle, no? Magsige man na sila in contact sa grass, the grass could create abrasions onto the to the feet, no? Especially on the coronary band because the cells there are alive. So if they are walking, no, there could really be a development of the vesicles, and of course the teeth, because during suckling, during milking, there would be a probable abrasions on the teeth surfaces, and later on, the formation of the vesicles. So vesicle growth and I grow and erupt at 48 hours. So when there is now the mechanical trauma, 48 hours they would grow, and at that very same day, perhaps it would also burst. And of course, later on, there will be secondary bacterial infection, and there is actually healing. No? 50% of recovered ruminants becomes carrier, and pharyngeal mucosa, uh, this is a problem. Yes, they heal, but 50% of them will become carriers. And they will establish a sustenance of the disease in the herd or in the area. Now, especially because the virus will later on settle down to the pharyngeal mucosa. And your pharyngeal mucosa is basically where the secretions from the lungs or the respiratory tract and the gastrointestinal tract would pass, no, before they go to the nasal cavity or to the mouth, no. So may mo silang source of the virus. So for the cattle, the virus would stay for around 3.5 years. For the sheep, that's approximately 9 months. Could say the same for the goats, and more than 5 years for the buffalo. So this is the problem with the disease because it could sustain itself inside or within the herd or the area. So initial sign is pyrexia, mahilantan sa na imong baka. And non-specific signs are your fever, dull, depression, erection, loss of condition, and of course, reduced milk yield. So there will also be nasal discharge, which would start as serous to purulent. This is the usual call this one the usual pattern for many viral cause of rhinitis, or yeah, they start as serous at first and then later on mucopurulent. But still, this serous could actually harden. Okay, serous. Naman na siya fibrinogens. So vesicles, with or in the mouth, with or without salivation, especially the salivation, because we are kind of particular with the salivation, because if you are to think of a lesion in the mouth, one of the things that you would most likely find first is salivation before the oral lesions, because salivation usually accompanies erosion or lesions in the mouth. No? So gingiva, gums, tongue, buccal cavity, and nares. For the feet, with or without lameness. Pwede siya mag-lame, pwede or dili. But if mag-lame, we still are very particular with the lameness because it is the most apparent sign that there is a feet or pedal involvement. No? So mammary glands and death in young animals. So there could be a probability for abortion, and usually the aborted fetus results has myocarditis. Well, myocarditis almost always apparent if there is bacterial infection or viral infection or any septicemic condition for your aborted fetus, and even in the young neonates. So here we have signs of the disease. Now, if you can notice, the tongue has multiple large mucosal erosion and ulcers. No, that siya nga ulceration, murag napahak gid ang tongue, and unruptured tongue vesicle, fluid filled blanching of epithelium. So this is very common, blanching of epithelium. Mura siya og ang epithelium as measured boils. Now these are elevations due to the vesicular growth, and of course there is apparent salivation. So bovine gingiva, is an elongate erosion. Here, vesicle on upper gum in sheep, and goat oral mucosa, there is a large erosion, ruptured vesicles. No, so the most likely thing that you would find is salivation, erosion, and vesicular growth. So here, interdigital cleft is also involved na siya ulceration. So the coronary band vesicles, this is a pig, however. So the coronary band has vesicular growth, foot and mouth disease, vesicles still in the pig. So unruptured vesicle, fluid-filled blanching epithelium in the interdigital cleft of this, I think this is a bovine. No? So the teeth is also involved, no? Teeth ruptured vesicle on the end of the teeth, so martial ulcerate na. And the teeth vesicles here in the bovine, there are black na area. These are areas of disease. So as for the diagnosis class, fresh vesicular fluids and epithelial tissues are needed. So from the fluids, katong vesicular fluids and epithelial tissues, so you could just scrape off the epithelial tissue itself. 1 gram refrigerated samples and put that in your phosphate buffered saline. Then later on, you could have your PCR. Your PCR or pharyngeal fluid and katong inyong vesicular fluids through probang cup or pharyngeal swab. So your probang cup basically makuaragid ka sa ilalong kanang samples. No? So ELISA for surveillance in countries with endemic status. ELISA is only used for surveillance but not as confirmatory. If there is zero positive animal, you could proceed later on for PCR or virus neutralization. Now, I have here your virus neutralization test. I really included this one here because nag-watch sa board exam. I had no idea pero correct ako answer. But used in the Philippines to test pigs before importation. Virus neutralization test. During my time, ang question is, ang choices is serum neutralization SN. So baby hamster kidney preferred culture medium. So when you are to do virus isolation, you can use your baby hamster kidney. Some diseases, if you have noticed, especially those which has arthropods, would use vero cells. Here you are using baby hamster kidney. So virus isolation, primary bovine thyroid cell culture. Well, you can use that one. And treatment control and prevention, no specific treatment and only supportive clinics in meglumine. Quarantine, movement control, vaccination, killed trivalent vaccine. So in the Philippines, we have three strains, diba? Ay serotypes. So you have your A1C. So our killed trivalent vaccine contains your A1C, endemic areas especially, and 3 times a year. But the thing that again in the Philippines, we do not test anymore for your rinderpest and your FMD. And we don't even vaccinate for them. Makasuhan ka mag-vaccinate kag FMD because atong status is without vaccination. So ma-revoke atong status mag-vaccinate ka. Okay. So inana siya. These diseases are not these 3 diseases are not present in the Philippines, but I'm still discussing it to you because of course there will be a probability of recurrence. So FMD is still considered an emerging or transboundary disease. No, not emerging, but a transboundary disease, and together with your pestidispedids. With your pestidispedids class, what happened is napagyapon siya actually sa South Asia, your India and your Middle East, and it's really spreading to the east. So there is a fear nowadays that your pestidispedids would reach your Southeast Asia, and your Southeast Asia has a lot of small ruminant mga. Okay, so principles for control and FMD outbreak. Prevent transmission from infected to susceptible animals. That is your number 1 thing in mind. So production of virus. So culture infected and in contact animals plus call infected and in contact animals. So mao na siya class ka mag-depopulation gid mo kung naay may bawaan nga positive sa ka area. That protocol from ASF plus actually is from the protocol used in FMD. Ilan din siyang reshape para mo fit siya sa current na condition sa Philippines. No? So your protocols actually for the disease outbreaks in the Philippines in epidemiology, magbalik-balik kaya gina siya actually lang protocol for every diseases. I-change lang na nila depende sa characteristics of disease and of course sa current conditions sa country. No? So potential for direct contact between animals. So ikwaon ni mo na siya. You have to get rid of these 4. So ang production of virus, katong mga in contact animals, tanggalon to nimo. Katong mga high risk, tanggalon na puto. Mao ni siya natay depopulation. So potential for direct contact between animals, movement restrictions. No, kabantay mo sa ESF karon, nagitay movement restrictions. Bawal ka magdalag chicharon from Luzon padulong Mindanao. That's part of the movement restriction. No? So same reasons with your FMD outbreak. So virus survival time in the environment, biosecurity, cleansing and disinfection of infected farms. So kanang inyong quarantinas. That is that tackles not that tackles also the virus survival. No? Kaya pat yun ang mga virus na musulod sa bukidnon. No? So number of susceptible animals, emergency vaccination or contagious carrying in severe situation. So the vaccination and your day population is part of is under this principle. Number of susceptible animals, remove them. No, or lessen the number of susceptible animals. Because remember in your epidemiology class 1 and 9, the computation for the incidence rate includes the number of susceptible animals. If you could lower the number of susceptible animals, there will be a lower probability of occurrence for the disease. Same concept with your COVID. Mabakunahan natin na, gamay din ang COVID, no? So, vesicular stomatitis will be discussed on the next video. Thank you.